feels good, man. This is a real money spot up in here, isn't it?
Yeah.
It's just
Hooks in,
and
getting deep and low.
it's really meaningful.
Yeah.
No matter who you are, you'd have some gunk in here, wouldn't you?
G'day guys, Darcy Ninja here. We're back for part 2 of osteitis pubis syndrome, or more commonly known as OP, and how we treat that. So we've done the video earlier on treating the pubic bone and treating the hip flexors. Now we're going to focus on treating the adductors and why they can be related to your pain locally around this area. First of all, I'm going to go over to this anatomy book and give you a little diagram of where these muscles are. So what we're going to be focusing on is adductor brevis, adductor magnus and adductor longus, and you can see that they all originate on that pubic bone and then come in down to your femur. So they all attach into different portions of your leg bone, some right down low, some in the middle portion, some up high. So to give you guys a little bit more idea, this would be on Ninja. This is our pubic bone, and this is where these adductors are all originating from and then coming down into this area here. So they're all into that. And we know that irritation in between here or misalignment from either internal rotation or external rotation of the femur can cause misalignment, and that pubic synthesis, that cartilaginous sort of tendinous matter there, can become irritated and painful. One more thing I want to show you before we move on, Nick, is a lot of you out there that have osteitis pubic pain will be able to relate to the pain that they feel deep inside them. It's either, for males, going to be in their scrotum or up underneath their testicles. For females, especially those that have just been through giving childbirth or a pregnancy, sometimes they can have lower abdominal pain or pain that's internal, and it's hard to describe. I'm going to show you why that treating the groins is important. So you can see on this diagram here, look at these red dots over here, Leo. We start. So these are different referral patterns for the adductors. So you can say that this is our adductor magnus and the referral pattern that it has in this leg. Now you can see internally that all these little dots here, that's like inside your testicles or inside your ovaries or inside your scrotum. So that can be released or ridiculed by treating your adductors. So referral pain or associated pain is the pain that we feel from muscles that moves down the body or goes to different parts of the body. So for the neck instance, we've got pain in our SEM, but it's causing headaches, that type of scenario. So that's why we go in, we treat the adductors to release the internal pubic pain that you've got. All right, so I'm going to show you exactly what we do. Where's our MyoWax? It's over here. So we've done our assessment in part 1. We've noticed that Ninja now needs some treatment in his adductor. So what I like to do is wax up my elbow, and Ninja, we're going to get right on this tendinous or fibrotic muscle, and that's his adductor longus or adductor magnus, the bigger of the adductors. And what I like to do is, you can see that that's a bit of a balancing act, is just go slow, pick up the slack of the tissue, and then slowly sink in. It's a bit of a connection, a bit of a partnership. We need to make sure that this treatment is safe because it is right up into the sensitive areas of the body. So we're going to make sure we go slow. Don't be too invasive. Calm your body as a practitioner. Calm your body as a receiver. And just allow me to sink into that tendon. So the tendon is pulling on that pubic bone. That pubic bone, it then becomes irritated. We get referral pain deep up into our internal organs or our ovaries, our reproductive organs. And that's why we just pin it. I'm just going slow and having a little bit of a feel now of how I can just carefully get into the right spot. And I feel like I'm starting to get there on Ninja now.
Yeah.
Takes about a minute or two for the muscles to relax and let me get into the money spot. It is another true money spot in the body because it's a perfect little scenario for an elbow or for a thumb to just sink in and connect into a corner where stagnation occurs, where the tissues are dehydrated, where they're not getting the same blood supply as the muscle belly might be. So we work into the tendon, we hydrate that area, and then we just use sustained pressure. Sustained pressure is not only helping to alleviate the pain, it's also going to soften the tendon, it's going to release the tissues, and essentially that pulling that's happening, think of a tug of war on the pubic bone. We may have two adductors that are really tight, pulling on either side of the pubic bone, causing some separation between the pubis symphysis. So that part between it, sorry, I've lost my little skeleton. But if that pubis symphysis is pulled apart because of the adductors pulling away, then you're going to have irritation from that as well. So, or we feel there's misalignment where the pubic bone's sitting up or down on one another, or internally or externally on one another. And it's usually from our larger muscle groups. You saw how many adductors there were. There's adductor, let me test myself, adductor brevis, adductor magnus, adductor longus, there's gracilis further around, there's pectineus up higher. All those are contributing to pulling on that pubic bone or around that pubic area. So I'm starting on the thickest and the most dominant here in this really tendinous adductor magnus, and I'm also getting a little bit of adductor longus because I'm broad. I'm not sharp with my elbow. There's elbow and there's forearm. And already we've been here for a few moments. Doesn't look like much is happening, but how's it going for you, man?
Yeah, good. Yeah, like just to back up what Das was saying, massive trust thing goes on. So you kind of want to go real slow and just talk people through things, and that's how you can connect into those deeper levels where you need to get to make that affect that change. So, but it is quite intense, but then you kind of have a sense of relaxation and trust because they haven't overstepped the mark. And not overwhelming pain and things like that, so you can kind of manage it and can breathe through and things like that. And that it just feels solid. What Das is doing to me, it's just a real solid connection. So that's what
That's
you
it in a
get
nutshell.
body word for.
Yeah, body work for. Yeah.
Yeah, you want solid connection. You want change. You don't want fluff.
Yeah.
You know,
There's a deep knowing, isn't there,
Yeah.
when people have this stuff, that's it. They can connect with it straight away.
Yeah.
I normally do go either the pubic bone, which we showed in the first video, where we start, but the adductors they're the money as well. Yeah, we've got to loosen them off, stop that pulling and that friction. But we also might need to go in and strengthen them. So there's that clean phase, there's that rebuild phase. They're both as important as one another, but I think the clean phase is the most effective and certainly has to happen first. Far too many times I see clients that have been on the journey of trying to fix osteitis pubis for years or for months, and it's reoccurring, and the issue is they're not doing the body work. They're doing the strengthening or the rehab or the corrective exercises, but you're skipping out on the most important part, which is cleaning the tissues, rehydrating the tissues, resetting the tissues, that are pulling and causing torsion or tightness. So just then I went higher on the pectineus. Now we're going to actually go up under into the gracilis there. And on my elbow I can feel bone. So the back of my elbow here, there's bone, and then down here I can feel more tissue. And again, that's where we want to pin and work.
it's good, man.
Yeah. Oh, bit slippery. Let's get a better
Slippery carpet.
purchase. There we go. That's a better purchase there.
Yeah, it feels solid. It feels good. I feel safe. Another important word, safe.
Connection.
Yeah. It feels good, man. This is a real money spot up in here, isn't it?
Yeah.
It's just
Hooks in,
hooks in and
getting deep and low.
really meaningful.
Yeah.
No matter who you are, you'd have some gunk in here, wouldn't
yeah.
you? Doesn't matter how.
Yeah. The further you go round
Whoa.
medially, you're probably going to hit some hamstrings,
Yeah.
some semitendinosus and some semimembranosus. Again, when the pelvis is misaligned or thrown out, it's important to treat, yes, the adductors, but you're also going to have quadriceps and hamstrings and hip flexors. Everything's going to be a little bit out. So giving it a really thorough reset by loosening off those muscles that are pulling on the pelvis is going to be effective. Nice. And sinking out of that. The sink out's just as important. I'm going to come around with my left elbow, Leo. I'm going to hit higher up into pectineus here. So right up there.
Whoa.
We've got glands in here. You spoke about these in the last. So you've got to go slow. Still want to hit the bone. And we've got our small muscle, our pectineus, which actually inserts into our lesser trochanter. So greater trochanter is that bone on the outside of your hip. The lesser trochanter is directly opposite to that. But again, originates on that pubic bone. And just sink in, stop that tug of war, give the body a reset. Sustained pressure. We spoke about it earlier, that's key. And ninja struggling. When your clients are struggling, it's good to just tune in with those. If the video wasn't here, if the camera wasn't here and I wasn't doing a video, I should say, I would tune into how he's feeling, and you know, my touch would be more sensitive. I would be going slow and being graceful and cautious, because it can be sharp. It can be really, really painful as well.
Settled down for quite a bit now, man.
That's good. That's good.
Takes a while, hey. Can't rush it.
All right. To give you guys a little bit more excitement, what we're going to do is we're going to treat all the way along that femur. So you saw the attachments. We've lost the book. We've closed the book. Sorry, I was going to refer back to it. Doesn't matter. We're going to treat bone depth level of those adductors. And it's okay if I start this end and push down, or come here and push up. For now, just for the sake of the video, we're not going to worry too much of the direction of the stroke. We're just going to worry about the depth, the thoroughness, and how slow we go at working to bone level. So pes anserine is right in here. That's it there. That's my starting point. I started on that with the back of my palm. And then I'm going to go deep and slow and peel away the tension by doing little oscillations, which is just like coming in a bit and out, but I like to stay in and then work it. How you feeling there, man? Do you have much
Good.
going on?
Yeah, there's plenty.
Heaps.
Plenty in there, yeah.
Yeah.
It's all good though. It's sort of very therapeutic. I know it's good.
It's a real treatment. I'm not fluffing. I'm not pretending for the camera. Ninja's actually going to be going through some experiences here.
Yeah.
Some real pain. Just reinforcing my hands with another arm, which gives me good purchase. There we go. Make sure you go slow. You're like a snow plow that's plowing away the snow, or moving away the debris, or what's got caught and stuck. And I like to just come back to this spot because I can feel that there's some adhesions along the bone, some lumpy bits, some little speed humps. Whereas if I was plowing the snow, I might have skipped over a few bits. I want to come back and do a really thorough job and make sure there's nothing there but the bitumen or the pathway.
Yeah.
There we go.
Get rid of the garbage.
Get rid of the trash.
Yeah.
Take the trash out. Clean it out.
Yeah. been taking the trash out late, haven't you,
Yeah, man.
Das?
Yeah.
Das is pretty toe in the water with a bit of a
Fast.
detox, a fast of sorts.
Yeah, it was
He had
more
his
of a
own rules.
detox. More of a
Yeah.
detox.
Yeah.
Detox from alcohol was the first thing, but then detox from food, and just allowing my body to have a rest from solids. So I did 62 hours, which is a 2.5 day fast, but I included celery juice, organic celery juice, lemon water, medicinal mushrooms or mycelium, tea, and bone broth at night. So nothing solid for a couple of days, and just experimenting with it.
How'd you go, man?
So I first ate this morning. Ninja had a mango the size of my head, which is amazing.
A big one.
It was a big one, and it tasted incredible. Yeah, pudding. You have a new relationship with food, don't you? You really have a love for food when you realise when you haven't had it.
Yeah.
I challenge everybody to give it a go. You find a new love for food, and discipline was the big thing for me. I wanted to keep myself accountable. I was motivated to do it, but it's discipline that gets me over the line. So that's why I really wanted to make sure that I did it, because there's plenty of times where I was like, ready to give up, or why am I doing this? Questioning myself. I should just eat. And I'm glad that I didn't. I'm glad that I pushed through. Yeah.
Get that full experience.
Get the full experience.
What you set out to do.
What I set out to do, exactly.
Yeah. I think big thing for Das, you got some little bit of community to do it. Like you got 3 guys, was it? Three.
So Elliot here from work,
Oh.
Scott, Zach. No, Scotty didn't do it. Rodney. Yeah, I'm not going to name names, but there was 5 that got involved. So speaking to them along the way, how they're doing, helping them with ideas of, one was asking me today, what food should I eat when I first eat, and how should I eat? It was just important to communicate and see how everybody was doing, what their experience has been.
Support is the word, isn't it?
Yeah.
You kind of don't do it alone, and you want support at home. I think is a really important thing. So you just, or if you don't have anyone at home, just support somebody else doing it with you.
Yeah.
Or parts of it with you if you're kind of doing something that's a bit more extended. Get people to go through it with you. You're not sort of solo. I think that's an important thing. And there's all, I suppose it's just talking on, because I've been doing stuff like this for 25 years, and it's good to kind of, when you begin, to try and do something that's not like a 40-day water fast, which people do, and 20-day dry fast. I watched this guy called Fasting with Trevor. He does 20-day dry fast, so no water at all or any food. So they're kind of like experienced, and they've got a real need to do something like that, because this guy was full of parasites and things like that. So he wanted to starve them off, but water could still feed them. So they find that it's necessary for them to do something like this. So, if you're kind of starting out, don't try and do something. Just try and do like a 36-hour is a good start. From Sunday night till Tuesday morning type of thing. Or if you just do a juice fast, or just cut out something that's a crutch. Oh, it's coffee, alcohol, drugs, whatever it is, that you put a time that you're not going to do it, and just stick to it. So. Yeah. And sort of by telling other people you're doing it, it makes you accountable, and you don't want to fail yourself, and you don't want to fail others as well. So it's good. We talk about social media detox is sort of a buzz thing these days. So it just means a fast, and you stop doing something for a period of time to go through that experience and see what it's like on the other side of it, and during it as well, if there's any light or
awakenings, epiphanies.
You can heal things, understand things. Epiphanies come through. I've had heaps of epiphanies coming through. And when I've been out pressure cleaning or mowing lawns, whippersnipping, you know, cleaning carpets, whatever. It's kind of like this, give your body a chance to reorganise and reset. And
That's your mindfulness. Yeah, you're
Yeah.
taking note of
yeah,
what's coming in. How's your body communicating?
yeah,
What messages are we ignoring them with? Distracting ourselves
Mm.
with porn, with Instagram, with Facebook, with Twitter, with YouTube.
yeah.
You can
whatever
keep
it
watching
is.
our YouTube though.
Yeah.
That's the
Whatever it
one
is.
thing. That's all right. We're helping.
Yeah. That was kind of one thing I want to ask you to ask, because I know that you're very structured with your food and stuff, and you like eating every kind of. I suppose you kind of put celery juice or whatever, you had different things that you ate, but you instead of having a solid thing coming, how was that for you to have no solid things coming into your gullet? What was that like?
Yeah, it was hard.
Yeah.
My first day was the most challenging. I think I'm pretty good at intermittent fasting, where I can not eat till 12 or 11. And my body sensed around that time on the first day that I'm used to doing that, and my tummy started to rumble and my hangry mind kicked in. And that was the worst part of the whole 62 hours, was that first lunchtime. Once I got through that, I was distracted with work. I did a workout. We did some Wim Hof breathing in our workout. I got home, I slept, I woke up, I wasn't even hungry, I didn't feel like breakfast. I easily got through lunch, and that was okay. Having the celery juice and having the mushroom tea and the bone broth to look forward to was enough for me to have something to look forward to get me through. The first day I didn't have the mushroom tea until that lunchtime break. Just mushroom tea, just the reishi and the chaga and the lion's mane in the tea. That was enough to look forward to at 12:30, 1 o'clock, and to sit down and enjoy that. That got me through. It got me through the next day. And putting a bit of lemon, organic lemon, fresh from home, in water, that was even a bit of a treat. And yeah, you learn to love food and just harness the toughness of it. It was hard, but just harness it and wear it, and know that you're challenging yourself, and with challenge comes great experience, and yeah, nobody can take that away from you. So
You got it, man. It's in
Yeah.
your bank, isn't it?
yeah,
Experience bank.
yeah,
And you keen to do another one? I think you said.
yeah,
So,
yeah. I'm gonna try
explore a bit further.
3-day. Maybe I'll just do a water one, but I'm gonna enjoy some food today. And go slow with it. Not just put junk, put wholesome food, food that's gonna nourish me, and not feed any of those zombie cells that were in my body that I essentially, they died off from fasting. That was the idea, was hopefully a lot of those had died off, the free radicals floating around my body, the parasites. Maybe we got rid of some of those if they were there. I'm not going to go feed them with seed oils, with
Sugar or
fried
something.
food, sugar. Sugar's the big one. Sugar. Yeah,
But fruit is very different though, because like fruit can actually continue on your detox. Yeah, because it's got the fiber in it. It's magic. Like it's electrified. Yeah, it's magical. So the fruit after is. That's why I
living.
gave you the mango. Yeah, because you've loosened things. Any debris that's kind of loosened up and hasn't, because your bowel sort of stops because it hasn't had food going through it. So there's things that are kind of pushed into there, and then the fruit comes through and helps to eliminate it. So if you put something in that's stodgy and sticky and you know what I mean, you can stick it back on the walls. Perhaps you don't don't release it out.
Yeah.
So yeah, what you do afterwards can help the detox continue.
Yeah.
So.
That's good. All right, guys. The importance of treating our adductors. We reiterated it. We spoke about it. If you've got osteitis pubis, make sure you do book in with a practitioner here at MMT, and we'll fix you up. Thanks for watching.
Get it done.